Welcome back to Cure Connections. Michael, thank you so much for sharing your bladder cancer journey, which is obviously ongoing. Dr. Plimak for giving us some insight into all these treatment options, and Sandy as the caregiver for giving all the backup support that Michael has spoken so highly of and how important it is. In this segment, we're bringing on Jeanne to talk about the nurse's role in dealing with patients who have many issues related to their bladder cancer. Jeanne, we've already heard from Michael about his initial diagnosis, presenting with blood in the urine, how he had the biopsy that went on to the surgery, and then the difficulties he had with the BCG treatment, then going on to more major surgery with the whole issue about bladder reconstruction, and hearing about how his disease was more advanced than was initially thought. And then very soon after surgery, having to face chemotherapy on top of all the physical and emotional issues that were whirring around. This is a lot of information for patients to digest, and at many stages the goals are changing with the expectation of treatment and finding out that the disease had progressed. What's your role in trying to navigate the patient and caregiver through these multitude of situations that are constantly evolving?
Well, through the course of his treatment, he's met many nurses at the urologist's office, inpatient, post-op nurses, and myself, I'm the outpatient nurse with Dr. Plimak. So he knows our role as his advocate and the ones that he can turn to with questions. But when I first met Michael is when he went to see Dr. Plimak in clinic. I met him after Dr. Kudakov. So my role is to meet him and his wife, Sandy, and kind of tell them what Fox Chase is about, what the medical side is about, because he's already aware of the surgical side, and what we can offer him. I try to put you at ease to let you know that we're part of a team, and because generally they come to us nervous for a second opinion, discuss clinical trials, just for knowledge, and I reassure them that's why you're supposed to be here. So you can relax while you're here. We're here with you and for you. So that's the initial greeting, and then we talk about a history. I get to feel the inside of his head, what he's thinking, how his coping mechanisms are, how the relationship is. And I could tell early on that you were very chill, like I'm just going to sit here and listen, and you were the one that you were going to retain the information. Right. So it's great to talk to two of you, and it's great to have a second set of ears. So that was perfect for us.
Now, every patient and caregiver that you meet, obviously it's a unique situation.
Correct.
They have a unique type of cancer and unique concerns, and obviously a different level of knowledge and what they want to know and what they already know.
Absolutely. So
obviously,
everyone's different.
In a segment like this, we're all about education, awareness, and helping patients learn more about the disease. Do you find that some patients have too much information and they're overwhelmed at a time that they may not be able to digest everything that they've been told?
So you mentioned Dr. Google in an earlier segment, and a lot of people do come in with many questions, stories about relatives that they heard years ago, how they tolerated treatment. And again, we want to hear all that because we want to know what you're thinking. So then we can help you go through that, fine tune it, correct it. But again, the whole goal of my meeting is to see why you're here, and put your mind at ease, that you're in the right place, let's get this done. I explain who Dr. Plimak is, her role, I get the history on the computer, and let them know that while you're here, ask your questions, whatever questions you have. If you need Dr. Plimak to restate something, feel free. I give them a phone triage phone number to call, because when you're driving home after that appointment,
great.
and when you're driving home after that appointment, that's usually when you can relax, and all of a sudden these questions, oh, I forgot to ask. So I make sure they have the number to call, because we have our own, Dr. Plimak has her own phone triage nurses with the same knowledge. So I put their mind at ease is my role, and then I talk to Dr. Plimak and give her feedback.
And how do you deal with the situation where you're obviously armed with all this invaluable information to educate patients about what they're going to go through and what potential side effects are? What happens when you have a patient who really says, you know, I really don't have any questions, I don't want to ask any questions, and yet you may have a spouse with a very different set of ideas who really wants to know, and there's
that's
this
generally
discourse.
the case. Yeah.
How do you deal with that?
That's okay. You know, there's nothing wrong with that. I will fine-tune that education to your needs, and again, reinforce to call us. But we also have a written information, a nice packet of written information. If we're talking about chemotherapy, there's a chemotherapy information. That everything's in that folder is what we're physically saying, and you can read over it. It is a lot of information on one visit. I try to get to the basics of what chemotherapy is, how it affects your body, and how it affects your body is how we can predict certain side effects. And our goal is to try to reduce these side effects by either preventing them and managing them, and how important communication is. We give you some information, but your communication is what's more important.
You've already mentioned that many patients come in talking about family members who may have had chemo treatments many years ago. Do you think that that's a barrier for patients progressing with treatment, or even?
It's a barrier, but I tell them a story. I've been an oncology nurse since '88, and I tell everyone when we would teach chemotherapy and give chemotherapy, everyone would get a basin for nausea and vomiting. And now we don't know where the basins are. That's a beautiful thing. So on those side effects, I kind of put a line through vomiting and say nausea is an issue, but it's an issue that can be maintained. We give you the correct medications. We pre-medicate you the day of treatment. We send you home with medications that you may or may not need. This is how you use it. If these medications don't work for you, again, call us, because there's so many other medications we can give you. But that's an advance from the 80s. Where are the basins?
Right.
We're running around if we ever need one. So that helps people.
Right.
That's a huge change. Research has made a big difference over the years. So I reinforce that.
Now, obviously, discussing treatments, protocols, and side effects of treatment is very important. How do you deal with the more difficult questions when patients start asking about, you know, is this treatment going to work? How long have I got to live? Am I going to live? What's the next stage? How do you answer those questions?
Dr. Plimak answers
Yes,
those
I do.
questions. I give them the emotional support they need, and then when Dr. Plimak's finished talking to you and educating you, I sometimes go back in and then reinforce.
Right.
There's different emotional support, there's support teams, social workers, there's other things that we can do. And again, I think that phone triage number is a wealth of information for when you go home. But again, I'll say it one more time, communication is important. What are your needs? Because everyone is different. So I want everyone to leave knowing that you're part of a team. You're not alone.
Now, you work with a number of different specialties dealing with bladder cancer. We've talked already about the role of the surgeon, the urologist, the chemotherapy treatment options, medical oncologists, radiation oncologists, and we're trying to give information to patients who are in this situation. Do you think there are specific questions that you could forearm a patient with and say, look, these are the questions that you need to ask to be proactive, to get more information, to even potentially steer your treatment to a better place? Can you advise
That's a
patients?
very good question. I don't usually advise on what questions, because typically patients come in with questions, and I reassure them that if you have 21 questions, please ask them all. So I don't generally guide, because they pretty much come in ready with questions. But again, that fear does block them, and that's where I try to get through that, so they're a little more relaxed and open for when Dr. Plimak comes in and has a nice face-to-face.
Michael, Sandy, you had the opportunity to meet on a number of occasions with Jeanne and get the extra information that you need. As doctors in busy clinics, we often just don't have the time. We know what we should do, we know what we want to say, and we want to educate people as much as we can, but sometimes giving you 2 hours worth of information in 5 minutes is overwhelming. How helpful was it for you to have the extra support of somebody like Jeanne
God
to
bless
guide you?
the nurse. Yeah.
We hear that a lot, yeah.
Yeah. Hey, doctors and surgeons, you got to have them. Yeah, but nurses are tremendous. It's almost like family. They're there for you all the time.
You have a very close relationship with Dr. Plimak, but were there certain questions that you felt easier to ask Jeanne, or was it easier to be able to?
I think that depends on the individual. For me, no, because I'm not held back in any way or embarrassed by anything. I'll ask a question to anybody who I think can answer it. But I think access to nurses is easier or more available, easily available, and we'll get that out.
Before I come on to you, Santi, how do you define access for a patient in 2017? Patients often have a lot of fear and anxiety at 3 o'clock in the morning. How available are nurses to address issues? You're available by phone and email?
There's an after-hours phone number, and that goes to the nursing supervisor. And again, our institution, it's all we do. So everyone has that same mindset, same knowledge base, and can direct as needed. But yep, 24/7.
And it's a nurse. I mean,
Right.
the first call does go to our nursing
an
team,
amazing
who are
service.
really integrated in the whole care process.
So my last chemo treatment, when I didn't think I could get in and do it and complete it, even though it's my last one, and I only have to sit there for 6 or 7 hours and have bags pumped into me.
Very anxious.
The anxiety was,
Driving down, the deep breathing, and
I literally didn't think I could do it.
yeah.
Yeah.
And Jeanne made all the difference
She
to
made
see
all the
through.
difference
Oh
in
my
the world.
gosh,
Yeah. Yeah.
She put him in a nice dark room. She soothed him. She played music for him. I think you gave him what?
I may have had a pill a day.
I said, is there something
Follow
you can-
doctor's orders.
Is there something you can give him?
Yes, and there was.
Yeah, everything. The whole nine there. The whole attitude. The whole environment of making me, the center of attention, able to go on and do what I needed to do. It was very important.